Assalamu alaikum. We'll start our communication day today. Dr. Rida, please read the scenario.
All right. You have been called to the ward overnight to speak to the son of a patient who is dying with end-stage liver disease secondary to hepatitis C and alcoholic cirrhosis. The patient's wife died last year, and his son is his next of kin. The patient has had multiple admissions over the past 4 years with encephalopathy and variceal bleeds. Recently, his ascites became diuretic resistant, and he was admitted with SBB. Despite antibiotic, his encephalopathy has worsened, and he now has a grade 4 encephalopathy, coma, and is currently breathing very irregularly. He has been deemed unsuitable for liver transplant due to ongoing IV heroin use, and he continued to drink alcohol. A note for resuscitation order has been signed by his team's consultant. You are not aware he had any relative, although he is well known to the unit. His son doesn't want the DNR. Please discuss this with a patient relative, address his concern, and discuss the reason why the DNR is needed. Son, we can call it Peter, father Edward.
Okay, turn me the list.
Welcome.
Okay, let's start.
All right.
كده عملت الكاس؟
يعني
ها؟
Okay, you can see the timer.
Yeah, start.
Hello there.
Hello.
I'm Dr. Mukhtar, the doctor in the ward today. May I confirm you are Mr. Peter
Yes, sir. Yeah, doctor.
and you are the son for Mr. Edward?
Correct.
May I confirm his age?
My father age is 62.
Okay, and you are next of kin for him.
Yeah, you are right.
We are here to discuss about his health issue. Is that okay for you?
Yeah, please, doctor.
Okay. Before starting, you want to attend this meeting?
Actually, I'm all right. Thank you.
Okay. Can you tell me more about Mr. Edward's condition?
Yes, doctor. Actually, over the last 4 years, my father has a recurrent admission to the hospital because of altered mental status and vomiting of blood. And actually, he's a known case of I think a problem in his liver. It's called like a cirrhosis. And it's secondary. They told us to a virus in his liver called hepatitis C. And also he drink alcohol. He drink much alcohol. Actually, doctor, this is not like any other admission. I don't know. It seems like he's still in coma. I don't know what the problem. And
Yeah,
his breathing is irregular. I don't know why.
yes, I appreciate your care and your knowledge about Mr. Edward condition. Can I know what's your expectation about his condition and this meeting?
I have no expectation. I do really want to know why he's not improving.
Yes, so if you want, I can explain to you about Mr. Edward's condition, if you
Yes,
don't mind.
please.
Yeah, so because of the infection of virus called hepatitis C virus,
Yeah.
and also due to his alcohol intake long time
Mm-hmm.
and yeah, frequent intake of alcohol,
Yes.
his liver being like scarred, and it's not functioning as before or as healthy one person.
Yeah,
So
doctor, I know this. So what's the new now?
yeah, the new now, this liver after scarring, it can't excrete some toxin in his blood, and
Mm-hmm.
this toxin, when it reaches to the brain,
Mm-hmm.
his awareness will be impaired as in his condition now.
Mm-hmm. Mm-hmm.
So it's a sequelae from the cirrhosis. It's called cirrhosis or
Mm-hmm.
scarring of his liver.
Mm-hmm.
That's why he's not able to breathe, and he's not able to communicate with you,
Mm-hmm.
and he's not uh, he's not well as before. Did you
Mm-hmm.
understand?
Yeah, doctor, I know. Mm-hmm.
Okay. Any other concerns so far?
Yeah, well, why he's not improving? Why he's still in coma? Why his breathing is irregular? Why the medical team didn't do anything till now to improve his case?
Yes, I appreciate your worry about Mr. Edward condition. I can feel and I can see you're so much worried.
Mm-hmm.
Let's talk in the medical decision point of view. Our consultant
Mm-hmm.
and a group of some specialists, they are thinking that the liver of Mr. Edward is not able to function again. For this reason, they decided a medical decision which is called no resuscitation or do not attempt resuscitation. Did you ever hear about this?
What do you mean that his
Yeah,
liver is not gonna function again? Have you tried any kind of medication? Have you given him any kind of medication before just making this decision, doctor?
yes. According to, I appreciate your concern and this question is valid. According to Mr. Edward's condition right now, it seems like his liver too much late and too much affected in the function. And that's why he had some of swelling and dilated or tortuous uh, blood channel in his gut.
Mm-hmm.
And so, in some situation, he also vomited some blood. This
Mm-hmm.
is one of the complication we consider as end stage of the liver. For this reason, we made our decision, Mr. Peter. Am I
All right.
clear now?
So the thing that I know is do not resuscitate. Yeah, I read about it before because of my cousin, but may you explain it more?
Yeah, I'm so sorry about what happened to your cousin.
Mm-hmm.
And let me explain if you want about the not attempt resuscitation. In case of
Mm-hmm.
his heart, Mr. Edward's heart stopped functioning or stopped beating We will not jump to his chest to do any heart massage or do pressure on his chest in order to resume his heartbeats.
Mhm.
Why? Because if the heart beating again, it will be with low quality, and it will be for short time, and it will make him suffer more than he is suffering now. Am I clear so far?
So you are just gonna leave him to die.
I appreciate your concern, and I'm afraid to say that Mr. Edward in his end stage means that it's better for him and to prevent any suffer for him and to let him die in peace. We will not do this type of what's
Why
called
why why
resuscitation.
in
So,
why not just why all right, doctor, why keeping him in the ward? Why
yes,
please like transfer him to the intensive care unit as usual, doctor? Why are you doing this for him?
yeah, I
Please.
appreciate your worry about Mr. Edward, but let me tell you that he will not benefit being admitted or being entered or transferred to what's called a critical care unit or intensive care unit.
Why, doctor?
Our yeah, yeah. Let me explain to you. Our management plan will be like end of life care.
Mhm.
We will just give him some support in his last days or last maybe maximum weeks,
Mhm.
and we will prevent any suffer for Mr. Edward. We don't want him to suffer more than he suffered
Is
already.
there like any option for my father, like a liver transplant, because they discussed it before?
Yeah, I
Any,
appreciate your knowledge about this technique. Let me tell you that in Mr. Edward's condition, it will not be valid. I'm so sorry, and I'm afraid to say that it's not a valid option for Mr. Edward.
why?
Why? Let me explain to you. Yes, because he is still taking alcohol, and this is one of the drawbacks of this technique or of this surgery. We can't do transplant of the liver
Mhm.
as long as the patient is taking alcohol. Uh, Plus, his complication in his condition, like his altered mental state or altered awareness, this is also against being thinking about transplantation.
So,
Am I
so,
clear?
doctor, but I don't want this, do not attempt to resuscitate. I want my father to be resuscitated as everyone else, please.
Okay. Yeah, I appreciate your worry again, Mr. Peter.
Mhm.
Let me arrange another meeting for you to be explained more about this decision. Is that okay for you?
All right, doctor.
Okay. Can I ask you some questions?
Sure, doctor.
Yes. Who's dependent on Mr. Edwards?
No, no one dependent on him.
Okay. And anyone, does he need any support, any kind of support at home?
No, we are all right.
Who's taking care of him?
Um, we was like, we hired a nurse, a private nurse.
Okay.
She's taking care of him. Mm.
You have any other concern?
No, no, not really. No, doctor.
Okay. Okay. I think time is up. Yes. 10 minutes. Okay. I will provide you some leaflet brochures and website about Mr. Edward condition liver cirrhosis, and you can read about it,
Sure.
and as well as some leaflet about the liver transplant, how to do, and what can prevent this technique. Is that okay?
All right, all right. Thank you, doctor.
Okay, thank you. So this is, I think the time is up. Let me hear your comment.
Yes, you did great. This is like an end of life of care scenario. You will just You can, the thing that good that you ask for, you have invited someone to attend the meetings, because this is a really bad news. It's like saying your father died already.
Yeah.
And the thing is, you can just touch the issue of SPP, like you haven't mentioned.
I miss this point at all. Yes, you're right.
All right, and you can also tell him that we have tried our best. We give him the water pills, we give him antibiotic, which is the antibiotic, but unfortunately, his liver is condition is advanced, and it doesn't respond to anything. I'm really sorry to tell you that, but don't worry. And good that you opened the issue of the end of life of care. And excellent that you told him he is not for the intensive care unit, because going to the intensive care unit means that patient will be for ventilation, and he is not a candidate for a CPR.
Yeah,
What else? The thing you haven't opened the issue of the advanced directive.
yeah, I didn't find time.
Better like not. Yes, and you answer the concerned good. Why not? My father is not for a liver transplant. Yeah, to tell him that I do really understand your worries. I appreciate your knowledge. What else? Thank you for sharing this. But your father, actually, your father has a limited option, and one of the option is liver transplant. But unfortunately, your father doesn't meet the criteria because he is still a drug user. I mean, he's still using heroin. He's still using alcohol. And this make the transplant invalid for him, as you said, exactly. Yes, that's it. This is the issue. Like you have to open the issue of the advanced directive,
Yes, exactly.
and the
Suppose.
issue of the yes, and the issue of the end of life care. That's it. That's the scenario. Thank you.
Thank you, Dr. Nada, for this scenario
Welcome.
and for the comments.
Yeah.
Okay, let's have a discussion, open discussion. Anyone has comment? Anyone has question?
السلام عليكم.
عليكم السلام. Yes.
أهلا دكتور باسم كيفك؟ I think if you did well, but I think if because relative asking what is the DNR, I think better to say to define that DNR is a step of action that include chest compression, breathing support, and sometimes we are giving electrical shock delivery. And this step normally is started when the heart of the patient was stopped working in order to start the working of the heart again. Sometimes this process succeed and sometimes may fail. In your further condition, actually, it was decided by the consultant and the team and treated team to not do it. Why? Because already your father in advanced stage and he may will not get any benefit from this processing and actually may suffer more because the risk of this it's more than the benefit because may get injury to the rib, broken his rib, or the bear or may get the burn from the shock, electrical shock. And I'm sure that you are not and will not give any benefit in his condition because already it is advanced. And I'm sure that you are not happy to make your father suffering more in his end of life. I think maybe it will be better if we say it like that.
Yes, yes, I agree.
Right?
So, yeah, I agree. But if you think it's the same idea and the same scheme we are doing, I mean, it's different approach or different words and sentences, but the aim is and the goal is the same. But you have some change in your words how to say that. Anyway, in general, it's accepted to do as you did or as you said, or the way I did also, it's the same how to do it, but the aim and the goal of do not attempt resuscitation is still explained. But everyone has his approach how to say that. So it's I think the idea is same but different approach or a different word. But still, I appreciate your sentences. It's valid. Okay. Thank you, doctor. Any other comment? Okay. Why advanced directive in end-of-life care? Actually, it will not change anything. Yes, but it might be with the decision. For example, if the son said, "My father wish was is to die at his home." What do you think this trans directive will be? It's helpful, so helpful. Yes, it's appreciated, and we can do that to appreciate his wish, and in order also to be in his family at the last day of his life. This is a good thing for the pros of we said pros and cons for advanced directive and end of life care. How to use it as a weapon if they said like that. But if the opposite, if he said against his best interest, like example, like for example, he said, my father wish was advanced directive is to do every attempt for his circulation or for his life to do as long as he's breathing. It will be against the medical decision, but still you can convince him this is not helping him in his situation, and the best interest for him is or will be the medical team decision, even though it's against the advanced directive. Why? Because it's clear that the case is advanced. So whatever you are doing, just let him suffer more than he suffered before. So the best way to convince or the best way to answer is to say this is will be like long time for suffering, and it will not help him as much as we hope or as much as you hope. It will be against, and if you compare the risk or the outweigh the risk and benefit for this, it will be more risky. He will have infection. He will have broken bones and tubes or pipes in his windpipe. He will be connected to a machine with no benefit. You should show him that it will be with no benefit because his liver already damaged and scarred and cirrhotic, and this is advanced case. I hope it's clear. But the thing you don't ask is the lasting power of autonomy. Why? Because it might interrupt your decision. If you said to him, who's the lasting power of autonomy, or who will take decision on behalf of him? He will say, yes, it's me, and I want to do everything for him. I want him to to be resuscitated or to support his life as much as you can or as long as he's breathing. You will be you will have argument with him, and this argument will be against the medical advice and decision for no value. So don't ask this question. The patient already as in of life care as in our case. This is my opinion. I hope that's clear. Any other comment in the message? Dr. Roda, I will leave the meeting. Sorry, Dr. Roda. Okay. Thank you for the case, Dr. Roda. And sorry, I couldn't give you the case. If you can join us back, we are waiting for you. Very valuable comment. Thank you. Very good. Thank you for Tawia. Thank you, Dr. Nora. Anyone has any other comments or question? Anyone has case he want to practice? Feel free to comment, to share. It's not a meeting from one side. It's an interacting one. It's an interacting one. So better to be like discussing together, not only me talking, even by commenting, either typing or verbally. Feel free to do that. So this is one type or kind of scenarios and phases in communication, end of life care, along with the other type, which is palliative care. So who can tell me the difference between palliative and end of life care? Yes, meeting for patients. Thank you, Dr. Ali. You can write for me what the difference between palliative and end of life care.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh. Yes.
I think, yeah, the DNR for those who is expected to be died within days or weeks, and the palliative care for those patient who may extend his life for
Excellent.
months
So
or
this, yeah,
even years.
excellent. This is one difference, yes. Palliative care patient might live longer than end of life care. But by the way, DNR can be for both of them. It's not for end of life care only, it can be for the palliative one. So it's depending on the patient condition and the medical team decision. He can put this patient on DNR and he can put the other also on DNR. It's not only confined to the end of life care. I might put cancer patient, he will be on palliative radio or chemotherapy. DNR, anytime he will have cardiac arrest, I will not do CPR for him. So it's not necessary to be for end of life care only. I can give both of them DNR for. But the difference, as you mentioned, is the palliative care might live longer and it will not affect his main or major line of management. For example, if a cancer patient and he will receive chemo and radiotherapy, so I can give him the palliative, which are some medication to support the feeding, some medication to support the infection, the malnutrition, also the depression for the mood. This is the palliative in brief. But the end of life care, you will not give any medication. You will just put him on oxygen. And sometimes also they are not connecting to oxygen if the saturation is okay. And you let him die in peace. And of course, he will die as soon as maybe minutes or hours or maximum days. Maximum. Like gasping patient in real cases. But palliative care, patient is conscious, oriented, he knows his prognosis outcome, and you will explain to him even the palliative itself. The end of life care, you are not talking to the patient, you will be talking to his son, to next of kin, because he's mostly dying. This is the difference between palliative and end of life care.
دكتور باسم سوري end of life care مش this mean DNR يعني don't resuscitate.
No, it's not only that. End of life care mean you withdraw even the medication for the patient.
Yes,
You
but
got it?
if the heart stop, he will resuscitate. No,
No.
this mean he will.
Of course, no. Yes, because
So
he's dying.
no any need for end of life care to
To
talk about
discuss
DNR
DNR.
because he already decide for yes because already decide for him DNR. If we have end of life care for one patient, there
How
is
do you
mean
know
you
if
will.
if explained to him before? Maybe not explained to him before. I
I
agree
say,
if the patient
I know
already
that is
DNR from the
if
start. Yes, yes, I agree to be as
Mm.
yeah, if already
and it is very important in يعني اللي هي palliative care because you should know if he has any
by
wishes.
the way, yeah, sometimes you can mention it in palliative and sometimes no mention. According to your task, maybe in the task just
Yes,
palliative.
maybe
But
we will
if
mention advanced directive, not specifically about DNR. Just if you
yes,
have wishes, you
you
can
can
write like that.
yes.
But in end of life care, I think end of life care means that you will not resuscitate the patient.
Of course, it will be included, definitely, because you will let him die. He's dying already.
Yes, we mean
So,
that this point not change anything in the situation. I
okay,
think,
let's
yeah.
talk. Okay, let's talk as a rule. Okay, any patient with end of life care, he must be DNR. Clear? Okay, a deal. Agree for
Yes,
this?
okay,
Agree.
yes. They
And
decide
any
for him
patient,
DNR, and this is what
yes,
we explain for, okay.
okay. Any patient for palliative care, not necessary to be DNR. I hope it's clear
Yes,
now.
yes,
Agree. Okay,
yes,
this is
yes,
the
absolutely, yes,
yeah.
agreed. Mm.
Yeah, this is my the point I discussed earlier. So by default, being end of life care, he will be not candidate for CPR or he'll be DNR candidate. And for
Yes.
palliative, yeah, by default, palliative he can live long either by DNR or without DNR. According to your task, maybe in the task, just talk to the patient and explain about palliative and no DNR explanation or
Mm.
information. But if they mentioned you explained DNR, so you'll explain DNR.
Mm.
Okay.
And if
Mr.
there is
Aisha, clear
the
now?
patient dementia or something, may also you will speak to next of kin, so also you will mention like if he has any wishes like that. But maybe you will not يعني the DNR by name. I think it's hard to mention it in scenario of palliative care.
Again, if written in the scenario and the task, explain
If
DNR to
written,
the son.
yes,
You will not
okay,
explain?
okay, yes, yes, I'll explain. Sure.
Yes, you'll explain. This is one difference also between end of life care and palliative. Palliative, he might be conscious oriented, moving, ambulating, everything is okay. But end of life care,
Okay.
definitely he will be bedbound. Patient is dying.
Yes,
Okay?
yes. Mm.
And either
Sometimes.
to let him die on bed or at home. In the bed, I mean, bed in the hospital or at home. Sometimes also that you can shift him from ICU because you will not provide him the care he needs in ICU. He just needs some support or some care in the ward. And also you can provide family to sit with him just for the end or the last moment in his life. Okay? But for palliative, no, it's not necessary he will die soon. He might live longer than you expect. I hope it's clear. Yes, both DNR. DNR for patient prognosis 6 months or less. Palliative to improve quality of life of patient, yes. Uh, as a rule, Dr. Adil, you said DNR for patient for more 6 months or less. No, it's not necessary, maybe longer. By the way, some patients live DNR for more than 1 year. Hospital policy, they are renewing the DNR every year or annually. So it might be longer than 1 year. And every year at the expiry or before the expiry date, you will renew it.
Yes. احنا كان فعلا في there is patient with us
Palliative
3
and
years
DNR.
we will renew. The patient dementic
Yes, he can.
that
Yes, he can live
like
again.
yes.
And he might be fine.
Every year
and
we will renew, and maybe he will live 5 years.
exactly.
Yes.
He might be more better or much better than you expected. Some respond to palliative radiotherapy or chemotherapy or whatever he's receiving, or by some hydration, or he received radiation or whatever, or your expectation for the patient was not as you expect. I hope also this point was clear. What difference between advanced directive and power of attorney? Okay, good question. So the advanced directive means any formal paper which was signed in the court and documented to be this wishes for the patient to be attached or to be followed if he lost the capacity or if he will die. As like wasiyah and okay, this is advanced directive. Lasting power of attorney means that someone who is the dependent or the patient dependent on, and he's the next of kin, definitely, because he will also take care of him, and he will be also taking decision on behalf of him if he lost his conscious level or capacity. This is the major difference. There is what's called living wish. What the meaning of living wish? If the patient expressing some wishes verbally, either while going to the clinic or while talking to nurse or while visiting the hospital for dialysis, while he's on the dialysis, he might express some, I don't want to be on the dialysis machine anymore, for example. Or doing in the clinic diabetic food, for example, and he's talking to the nurse or to the doctor. Actually, I don't want to be underwent debridement surgery, or I don't want to be amputated for my leg to be amputated if it needs. So this is living wish, and it will be considerable. I mean that if he being in septic, diabetic septic food and gangrene by any type of gangrene, or either dry or wet, and you decided for surgery, and this wish was verbally expressed by the patient, and he was conscious and fully competent at that time, you can consider it as living wish, and you don't need to do this amputation. Even he will die with. Okay. What is the strongest one? The advanced directive, because it's documented one and it's written one. Then the living wish, because it's verbally expressed by the patient. So again, because of the patient words. The last one, the lasting power of attorney. And be sure, if the lasting power of attorney, I mean the decision of him against medical advice, you can do your decision, whatever his wish. and if it's against at all and he insists to follow, you can also ask for legal advice or help if against the medical advice.
Why legal, Dr. Basim? For power of attorney, but there is one point. It is not next of kin. Maybe not next of kin. Maybe anyone he will nominate to take decision in health condition or in financial condition. Maybe he will nominate one for something and one other one for something, and maybe he not related to him. Maybe he just a friend, just a neighbor, not next of kin. Maybe he didn't care, but he is the one the patient trust in him. And this also like the advance directive, it is paper and it is documented and done on lawyer office, and it should be documented, like not just a paper notes يعني they wishes. So power of attorney, I ask many times about it. He can he can decide even it is against medical advice. But you should first in scenario يعني that come, you should first advise and mention how it is like a patient who refuses medication. You will do the scenario like this, and at the end you will mention just if he insisted, you will I'll arrange another. You can include other member of your family in your decision. You can think again. It is very important for him. He maybe his health in danger if he didn't take this medication. Yeah, and you can mention, and you can arrange another meeting. You can let him thinking, but he has the right. You will not say you don't have right, or we will refer the issue to the legal. I asked about it many times, and they said like that. No, he has the right for, like the patient, for antibiotics refusal, for the charge against medical advice.
Again, if against
if attorney, power of attorney.
Yes, if against medical advice.
Yes.
So let's take example of diabetic
against
septic
the best of interest of patients. Yes, he can take.
Okay, let's take example diabetic septic foot. Okay, patient with diabetic septic foot, and the patient expressed that he doesn't want to do amputation. Okay, and this son or the next of kin come to you and he said, do the surgery, doctor. So you do the surgery. It's one of the cases, by the way. دكتور
الصوت رايح يا دكتور باسم، ما في صوت.
ما في. The last work attorney will not do anything unless the patient is unconscious. Yes, of course, he will not be. It will not be valid unless the patient is unconscious. Arrange another meeting with consultant. Avoid conflict. Yes, of course, I agree. By the way, don't confront for any reason. Thing with confrontation it will be against you. Okay, again, I
just
will
not يعني for to refer the situation to the legal. Just don't mention this.
Yes, okay.
Because
okay,
he has the right.
Answer this. Yes, he has the right, but if the right against the medical advice or against the living
like
wish.
a patient, any patient has his right to take decision against medical advice. but he will sign a paper and it is with his responsibility, and you will make the scenario like any patient
Against
refuse
medical
medication. You will
advice?
try and try and try.
Against medical advice?
Yes.
So, Dr. Aisha. Okay, let's take the example of diabetic septic shock as I mentioned. Okay, diabetic septic shock.
I ask this situation specifically for Dr. Hassan.
Okay.
On patient refuse power of attorney, has power of attorney and refuse antibiotic on behalf of one patient not unconscious now.
Refusing antibiotics. Okay, and he's the nursing of attorney. He said to you, no, give antibiotics.
No, Dr. Hassan said you will deal with this situation as patient refuse medication, and you will try, and last thing, you will advise him to think again and to include anyone and take opinion from any or discussion with anyone of the family, and they will arrange another meeting like that. But you will not tell them that they not have the right to refuse.
Can I say, if the patient is refusing medication or confused, we apply for the patient what we call DOLS. DOLS is deprivation of liberty of safeguarding. So we can give him any antibiotic for his best interest. We'll sign a form called DOLS. DOLS is the abbreviation of deprivation of liberty safeguarding. Any patient is confused, or I don't know the scenario, I came with a meeting in the middle, but for any patient refusing medication or confused, for his best interest, we'll sign the DOLS form to give him the medication.
The scenario is against that it is antibiotic with best of interest, and the patient has no any wishes about the antibiotic and no refusal. But the power of attorney one, the one, he refused to give the patient the antibiotic.
So we'll apply the DOLS form. We'll tell the nurse we'll apply the DOLS forms and we'll give him the antibiotic for his best interest. This is what we are doing.
Okay, my question or my example. We have patient with diabetic septic shock. Okay, let's do in this case. And the patient refuse amputation. Okay, and
but if the patient has the full mental capacity to refuse amputation,
yes, he refused. Yes, he
so
refused
he can refuse.
Okay, and the medical advice or medical decision also not to operate him for comorbidity. And the lasting power of attorney came to you and he asked you, no, doctor, do the surgery for him urgently.
No, this is against patient wishes. Yes.
This is if the patient has the full mental capacity, he can refuse anything, and he can do what he wants according to the patient. And also, if it is a consultant
if the patient
decision,
if the patient lost the capacity after that,
if the patient doesn't
decision, yes.
If the patient doesn't have the capacity,
even if he lost after that, we will respect the wishes.
If the patient doesn't have the capacity, the mental capacity, the full mental capacity, and the decision not to do for him the amputation, we won't do it.
Yes, this is my opinion as well.
Yes.
But Dr. Aisha said no, we will follow the lasting law.
No. This is as the same as
no, Dr. Bassem, this is
no, this is the same as the not resuscitate.
The patient has true wishes. If he lost
yes.
If the patient has wishes, we will respect. Even if he lost, if he dementia now, if he has no capacity now, we will respect the wishes.
But if it is a consultant decision, the consultant decision will be has a priority. It is if it's a medical decision, yes.
Yeah. Let's cancel the patient's wish. And this patient, the son or next of kin, came to you, and the medical decision is to not to operate him, to do amputation. And this is the medical decision. And he came to ask you to do the amputation. what you will do.
No, we won't do it.
الرايت
We
بتاعت
won't do it.
البيشن يا دكتور انه to refuse not to
Don't, yes, not to
Yes.
ask.
just have
This another
even the
point
patient,
أصلا.
not next of kin, even the patient, if he say I want to do this operation, this is not his right. His right only to refuse, like not request. A request ده المedical decision only.
Okay, I agree for this point. Yes. So we are agree now for the same point, Dr. Aisha, or still we have debate?
No, yeah, just it is one scenario, a specific scenario, that when a power of attorney refuse antibiotic for one patient, and the patient and asked to he will give him some herbal at home, and he refuse antibiotic for him. This is a scenario. Okay.
The patient want to take herbal.
No, the patient now he lost capacity, and he has power of attorney.
Okay, and he requested to give antibiotic.
Refuse to give him antibiotic. You will take this situation exactly like situation of patient refusal medication. The exact steps.
Okay, agree.
So
If the patient, doctor, if the patient
you will discuss what is the benefit and what is the danger, and you will insist about the danger and the benefit 3 times, and you will discuss another. You will try to arrange another meeting. You will provide him with brochure. You will ask him to discuss this issue with another one of family.
Yes. What is the medical decision? Not to give.
Medical decision, antibiotic. He has infection.
So if the medical decision to give antibiotic, we will apply the dole form and we'll give him the antibiotic. And he doesn't have the mental capacity, as you said.
I don't know about this form. Yani if you work in UK, yani?
I'm working in the UK. Any patient is confused. We have a lot of patients that are confused and refuse to have medication.
Yes, we know. If no power of attorney, if no other, nothing to look for.
No, the power of attorney is to take decision for the patient, which is for his best interest. But if this antibiotic for the best interest of the patient, and the patient doesn't have the mental capacity, the power of attorney doesn't have the right to give to say the medical decision will be the priority. I'm saying that the doles we are applying for all patients. This
I was suspected. I was thinking that before, but I asked this directly.
No.
To one
in all the hospitals, we apply the dole form for any patient that he's refusing medication and doesn't have the mental capacity. It is the same as the do not resuscitate. If the do not resuscitate, any patient will be admitted. We from the beginning, from the admission, we'll do the do not resuscitate form if we find it suitable. Even the power of attorney refusing to have the do not resuscitate, or even the patient refusing the do not resuscitate, and it is a medical decision, we'll apply the do not resuscitate. Anything for the best interest of the patient, but to make ourselves safe as a safe doctor, the patient refusing nasogastric tube. So what we will do, we'll apply the dole form, we'll sign it from the nurse, and we'll apply the nasogastric tube and put mitens, the gloves in his arm, in order not to pull the nasogastric tube. Diabetic patient confused, doesn't want to have medication and she's confused. We'll apply the dole and give her the medication.
But he isn't confused, not capacity, no capacity. This is different.
Confused or not?
Very different.
Both.
No capacity in this situation to apply this form. No capacity.
If he doesn't have the capacity, we'll apply the dole form also. Because
yes,
this is for
if he has power of attorney, you should.
No, the power of attorney is not for the. If it's a medical decision and this is for the best interest of the patient, the power of attorney doesn't have any rules in this. You will give the patient.
I don't know. Just if this your information, okay, but
this is the same as any patient. Any patient should have the full mental capacity to take the decision. If he refuses anything, and has the full mental capacity, we will do it. If he doesn't have medical capacity, it will be a medical decision, and we'll apply the dole to make ourselves safe. This is the things that I know. I don't know if you want to add anything, but this is what is applied. Because I'm working in the hospital and I'm seeing. So any patient is refusing anything and doesn't have mental capacity, we will make ourselves
safe. Is a hospital in our area different legal issues there.
No,
So
but
I
you should,
No,
but
it's
you should
worldwide.
I need one
respect.
working in UK because I asked Dr. Hussam exactly about this situation and he tell me it is like refusal of medication and he has right. But you should
No,
not
I'm
follow
working.
this
I'm
from
working.
start.
I'm working in the UK and in London, and I think the MRCP, it has all the rule in every country. So you should say, I will apply the dose and give the patient the medication. It's
Okay.
Yeah,
so.
I
This is
agree.
what I know.
Yeah, maybe that scenario is different, Dr. Aisha.
Maybe.
We don't know.
Maybe.
Yeah, the whole circumstance of the scenario. So I can't also, we can't answer.
Just review also the UK what is this guidelines because I wrote it also I read it about the sites in the sites of their power of attorney rights you will find just to take notes
Okay,
about.
let's
But
let's
I
share
don't
it in
know
the group.
about the doses that Dr. Sivik about.
No, but let's read it and find it, and we can share it to be
I'll send
beneficial
you
for
the
all.
dose, and you can read
It
about
is
the
it's
dose.
right
So
by the name. He has right to refuse antibiotics like that.
I'll send
Thank
it to
you.
you. And you can-
Yeah, thank you, Dr. Sarah. In the WhatsApp group?
Yes, I send it now.
Okay, thank you so much. Yes, okay, I agree, and better to read it and update ourselves if any change. But what I guess and I believe, the medical decision can override any of these all unless the patient wish is against the medical advice.
So if you
Otherwise,
read
yeah,
in the dose that if it's only if there are in person best interest. So this is for the person best interest. The power of attorney, the decision of power of attorney is not for the if he said I don't want to give him antibiotic, this is not for the patient best interest. So you shouldn't listen or obey to this.
yeah, early for this. It will be also after the medical decision. If the medical decision not been overruled, yes, it can be. If the and the son is not to or the last or attorney said no need to decision, even his last or at all. Anyway, as the discussion was grateful, let's read more about all the situation and we can summarize whatever the finding or the summary of this guidelines. We can have the discussion on the WhatsApp group. Okay, thank you, Sarah. Thank you, Dr. Aisha. Any other question or inquiry about these points, Dr. Aisha, or others? By the
No,
way,
thank
good.
you. Thank
Yeah,
you,
good
Dr.
to address this in our meeting because whenever you have a clear answer, you will be more confident with this answer, and you can do it in the exam with more confidence. That's
Yes.
why I always encourage all to share and to talk. The hot discussion make the information more clear and it will be more practical with you. Okay. Any other comment or any other question? We'll thank again Dr. Rhoda. We are sorry not to give her a case. She went out. Hopefully in coming days I will give her a case. Any question or any comment before ending this session? I'll share it soon in the WhatsApp group. Thank you all. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Have a nice weekend.